It is well known from multiple laboratory studies that vitamin D has activity against many different types of cancer, including colorectal cancer. And this led scientists to wonder whether there is a role for vitamin D supplementation in the treatment of patients with this disease. In our early studies, we looked at blood levels of vitamin D in patients with colorectal cancer, and we found that those who had higher levels of vitamin D in the blood had longer survival compared to those who had lower levels. And this led us to design our first small randomized phase 2 trial called Sunshine that did show that high dose vitamin D significantly delayed the progression of patients' cancer compared to lower doses of vitamin D. The promising findings from the Sunshine trial led us to design the current larger phase 3 randomized clinical trial called SOLARIS. SOLARIS was a large study sponsored by the National Cancer Institute and conducted across several hundred cancer centers across the United States. We enrolled 455 patients with previously untreated metastatic colorectal cancer and randomly assigned them to receive high doses of vitamin D3 combined with standard chemotherapy or lower doses of vitamin D3. We learned several different important things from this clinical trial. The first is that high-dose vitamin D did not seem to add any additional toxicity to standard chemotherapy, with no additional concerning side effects seen in our patients. What we did see, though, was that unfortunately, in this larger phase 3 clinical trial, high-dose vitamin D did not seem to delay the progression of patients' cancer any better than lower doses of vitamin D. What this suggests to us is that at this time, high-dose vitamin D cannot be recommended as a standard treatment for patients with previously untreated metastatic colorectal cancer. We did see an interesting finding in the results, though, that seemed to suggest that perhaps patients who had colorectal cancer arising from the left side of the colon or the rectum may derive benefit from high-dose vitamin D compared to standard dose vitamin D. But these findings are preliminary and require further investigation and confirmation. We did collect multiple blood samples, stool samples, and tumor samples from patients who were enrolled on the study, and we hope to be analyzing those specimens in the coming months and years to better understand the blood levels of vitamin D in our patients, and also about the biology of vitamin D in these tumors and whether it may have a differential effect in left-sided versus right-sided cancer.